An experience happened to me about 3 weeks ago where I entered Cottonwood Emergency Room about 11 p.m. at night having an anxiety attack. They didn't ask me what was wrong with me. They asked my friends that took me. Now, as I thought I was coming here today to speak with you guys, I thought, now that's wrong. Who's the patient here? So I kind of got stern with the nurse and the doctor. I says, who's in the bed? Who's wearing the gown? Do you see him wearing a gown? No. I'm wearing the gown. Talk to me. You know, because what you see a lot of is the people that can talk, they don't get to talk to the doctor. And that's because the parents are either in the room or just being parents and being nosy.
I'm a success story in this regard. As Justin said, you really have to involve the patient, not just the parents. And probably when I was 10 or 11, I would say, is when my parents were then asked by my pediatrician to no longer be in the room, and I would now be in my own appointment. And as a result, I can now go to my own appointments on my own, talk to my physician, ask my questions, and get all the answers I want.
I think as doctors, this can be helped to be cultivated by encouraging the patients to make their own appointments. We talked about stuff like this in one of our meetings, to have the student or the patient make their own appointments and call in their own prescriptions and keep track of when they need their prescriptions refilled and when they need to get those, and keep track of taking their own medications and stuff. And there's so many things in life that they need to be able to do on their own, but as doctors, I think if you can help push that, that would be at least one little category that these people can be independent and learn to take care of themselves.
I guess just encourage independence is the whole point. I now cook for myself and for my parents, a little deal we worked out. Early on in my life, they taught me to be independent, and I think at this point, Mom had a little song that she used to sing about independence, and it's now come back to haunt her because I tell her to do things for herself. But ultimately, I think independence is a very important thing. I was able to go off to school. I can show my friends what I'm able to do. Physicians, I think, ought to ask, is your child able to do their laundry, to balance a checkbook, and encourage parents to get their kids involved in that sort of thing.
I had some questions about future situations around the time that you start to question about your body and things, whether I could have children and things like that, but you just don't feel comfortable asking it when your mom's right there because she doesn't even know you're thinking about it, or she doesn't think she knows, but I think if the doctor takes a moment to realize that the child is in the portion where they would start to think about sexuality, maybe take a moment or encourage the child to ask questions, or maybe ask the parent to step out of the room for a minute. So.
And I'll go back to the age when I was 12 and had my first IEP. And having that first IEP, you don't know who to really involve. You don't know whether to involve your doctor, of course you're going to involve your teacher, and of course you're going to involve mommy, but do you involve the doctor? The answer to that is yes, because then the doctor can be informed of what your goals are in life without you having to retell them maybe an hour later.
I know when I was growing up, this is kind of touching back on learning skills at a young age. I had a person that worked for Jordan School District come out to my house maybe once a month to help me learn how to adapt my house to make it more accessible for me as far as marking appliances so I could work them by myself. And I think that's important in becoming independent at a later age is, learning those things at a young age and having it be a part of your life before you have to go out in the world and experience the things that that brings.
We need to stop and think, whose life is this that we're making decisions about? And what does this person want and what does this person need? And I don't think it's very good for parents and teachers and doctors and professionals to sit down and decide this person's life and their path, and to make decisions for this person. You know, people with disabilities they do have dreams, and they do have goals, and they do have things they want to do, and they have fears, and they have worries and concerns. And this is the person that has to deal with the disability more than anyone, is the one with the disability, and they need to be able to have control of where their life is going and what's going to become of their life.
What one thing do you wish your doctor had maybe helped you communicate to your parents?
One thing is how to explain the disability in layman's terms. I actually had to research it myself a little bit when I started to get interested in it. My mom kind of, because I lived a life of quote-unquote normality for so long, when I'm like, what's this kind of surgery? What happened here? She doesn't remember. So something like asking the doctor to explain it to me in layman's terms or something. And now that is my responsibility to ask, but when you're younger, even when you're 5 or 6, if the doctor can explain, you know, this is what's going on, then you're more likely to understand what your disability is when you get older.
What would you tell your primary care provider is the most important thing for you in transitioning to adulthood?
Just plan earlier on. I came back from college after not having any kind of interaction with my pediatrician for a couple of years, and then asked him, so who do I go see? And he had no idea. And I think it's probably a lot harder to find an internist or someone who's willing to deal with someone with special health care needs than it is for a child who doesn't have special health care needs. So plan earlier on. To me, all of these tips come down to the idea that people with disabilities may present more of a challenge, but ultimately their goals, everything that you do as parents, as physicians, is going to be fairly similar for someone who has a disability or doesn't have a disability. They just present additional issues that you need to work around.